So good morning, everyone. Welcome to COVID Impact 360 Conversations. I'm your host, Larry Cole. I appreciate you joining us. Today, I have an old friend of mine. He's my secret weapon, and I'll get into a little bit of that in a moment, but I am so pleased to have Dr. Roy McGroarty. Please excuse me, but I'm going to call him Doc Roy because that's what I call him, and I'm very proud and honored to know him. And good morning, Roy. How are you?
Good. Well, it's actually good evening here, Larry, and I'm doing fine.
Thank you very much for coming on. Now, what I'd like to do, Roy, is two things to set off this this discussion. One, I want to tell people how I know you. And then number two, I want to talk about a subject that is very important to you and me. And it's the communication of what COVID is. So I'm going to, first of all, share with people that I met Roy not long after the pandemic started. It was maybe a year after the pandemic started, and Roy sent me some notes through LinkedIn, and I noticed that he's one of these guys that has way more letters behind his name than in front of his name. So I knew that he was a science guy, and I'm not a science guy. I need to learn from the best of the best. And what pulled me into Roy's world was he had a way of teaching me, mentoring me, and helping me understand the complexity of the science world. And he knows that I appreciate that. In other words, he makes me look smart, and that's hard to do. So Roy and I talked quite a bit, and then about 3 months ago, I asked Roy, and he's a bit of a shy guy. He's not a camera guy like me. I asked Roy, would he mind doing a series of videos with me? Because I believe the greatest favor we can do to the world is to give a grade 7 education of what are viruses, what is COVID, and kind of clean up some of the real nonsense that's floating around the internet about what COVID is and how it got completely out of whack. You will find out pretty quickly that Roy has a talent that is very specific that I think is needed, and that is taking complex issues and helping people understand it. So, Roy, is that a fair way of explaining how we met and what our goals are today?
Yeah, it certainly is, Larry.
So let's start at a logical place. Give me a 2-minute background of who Roy is, because I think that's important in this conversation. Who are you? Way before the pandemic, what have you done in your life?
Yeah, Roy is a guy who spent way too many years in university collecting degrees. And I attended the University of Waterloo, UBC, and U of T. And I did cell biology. Then I did cellular and molecular biology as a master's. I did a doctorate in medicine, in immunopathology. And then I did clinical studies in infectious diseases, virology, and public health. And currently, I'm assisting all of the countries in Asia and have been doing so for the last 5 years as the pandemic response director.
So that's an interesting thing you just said there, is that, like, you and I both know that my interest is in COVID and long COVID and vaccines and solutions and all that stuff. That's my interest. I needed somebody that had a deep understanding of infectious disease and how to explain COVID from the get-go. So maybe we go there next. Let's talk about what is a virus. What is SARS-CoV-2?
Okay. Well, a virus is one of the 4 infectious organisms that we find on planet Earth. So there are viruses, bacteria, parasites, and fungi. The difference with viruses is that they do not have the ability to reproduce on their own. Viruses have to get into host cells and then commandeer the host cell machinery for transcription and translation to make new copies of themselves, and those copies are called virions. Once they escape the cell, they infect other cells, and eventually, with SARS-CoV-2, you breathe it out, and if you're infectious, you will be infecting other people.
So, what is SARS-CoV-2? What is that? What's the history of SARS?
Yes, well, it's actually, we need to talk about the history of, let's say, the last 4 pandemics. In 2009, we had a pandemic that was an influenza pandemic, but the next 3 pandemics were all coronaviruses. First came SARS-CoV-1, then MERS-CoV, and then finally SARS-CoV-2. Now, there are also 4 other common cold coronaviruses. So there's 7 in total now, 3 of which have caused the last 3 pandemics.
Okay, so I want to know what COVID is. What's COVID-19? What is that?
Yeah, so COVID-19 is an RNA virus. It's something called a positive sense that you really don't need to worry about. It just means the way it gets read and then turns itself into proteins. So SARS-CoV-2 is a member of the coronavirus family, but it acts very differently than all of the other coronaviruses that we know of. So the 6 other coronaviruses are distinct from SARS-CoV-2. And there are multiple ways to define, what a virus is. But essentially, I'll make it really simple. It's a lipid membrane containing genetic material that specifies all of the instructions to copy itself. Since it doesn't have the ability to self-replicate, it goes hunting for hosts, and in those hosts, it co-opts the machinery to be able to reproduce itself. Now, SARS-CoV-2 came out in late 2019 in Wuhan, China, as I'm sure everyone's aware, and it became a very scary virus very quickly, in that once it got into the human population, and it did that almost certainly by what's called a natural zoonosis. So a reservoir may be the bat, but there's an intermediary species, a mammal in between, to be able to go from the bat's coronavirus to be reconfigured in the host animal, and then it has a spillover event into humans. Okay? And so we don't get the coronavirus directly from the bat reservoir. It has to go through a host animal species. And when you start looking at this particular coronavirus, you find out that initially it was highly a respiratory virus. And this is what caused all of the grief and damage around the world that started in Lombardy, Italy, and continues to this day. And being an RNA virus, these types of viruses don't have perfect abilities to copy themselves and to correct errors. There are special molecules in cells that when you try and replicate the genome to make hundreds to thousands to millions of copies of yourself as a virus, the only way it can do it is using a host machinery. Bacteria can self-replicate, parasites can self-replicate, and so can fungi. Viruses cannot, and that makes them distinct from all other organisms. There are about 229 viruses that infect humans, and viruses are absolutely ubiquitous. And I'd like to give you a really quick example of what I mean by that. If you went anywhere in the world and grabbed a single milliliter of seawater, 1 mil, and for those of you who don't know the metric system, it would be 1/5 of a teaspoon, a very, very small drop of water. In that small drop of water, you will find 10 million different viruses. Doesn't matter where you go in the world, what ocean you choose, that's what you will find in 1 mil. So it
Yep.
we
Wow.
we live in a sea of viruses. And as a matter of fact, in your body today, you probably have somewhere around 380 trillion viruses in your body. The vast majority that will do nothing to harm you whatsoever. So just as you have a bacterial microbiome, you have a virome as well. Okay. And a
Okay.
lot of the
All right.
viruses in there are viruses against bacteria, not viruses against us. And those viruses against bacteria are called bacteriophages. So there's always this running battle going on in our colon between the bacteria that help us to live and the bacteriophages that want to get rid of them. Okay. So think of it like an antiviral force for a virus that infects a human. In the case of bacteria that live with us in a commensal relationship, meaning we help each other, so we need those bacteria to live well. They're mostly in the colon. But that just gives you an example. So you'll probably have right now in your body somewhere around 37 trillion of bacteria, mostly living in your colon. And that's roughly equal to the number of cells in your own body. So the number of viruses in you is orders of magnitude higher than all bacteria and your own human cell. So simply, the SARS-CoV virus, as a member of the coronavirus family and as the 7th coronavirus to now infect human beings, when it popped up in Wuhan, China at the end of 2019, it caused severe respiratory difficulties. It's called severe acute respiratory system coronavirus-19. That means severe acute respiratory virus found in 2019. Okay. It differs from SARS-1, it differs from MERS, and it differs from the 4 common cold coronaviruses. Okay. It obviously took over the human population. Within a matter of months, it spread to 215 countries and territories around the world in roughly about 4 months. And that, by definition, is a pandemic virus, and that's why it was declared a pandemic and a public health emergency of international concern. It was brand new to human beings, so it's an emerging infectious disease, and it causes havoc in the humans in virtually every organ and system in the body because it attaches to a receptor in us called the ACE2 receptor. SARS-CoV-1 also used that receptor. So did MERS-CoV. Okay. And the SARS-CoV-2 virus is fairly large as viruses go in terms of how much genetic material it has. As I said earlier, it's an RNA virus, and it's about 30,000 nucleotides long. Okay. And that's fairly sizable. And where part of the problem starts in trying to treat this, to try and develop vaccines for this, comes from the fact that it doesn't read its genetic material in our own cells with high fidelity. So it makes little mistakes. So it gathers mutations quickly. And when it gets into a large human population like it did in 2019, 2020, right up to today, um, that virus then, when it's going through these changes, these reading errors, it also naturally has a rhythm of about developing two mutations for every 2 weeks. And so when you have millions of people infected with it, it has all the room in the world to make multiple different copies of itself that we call variants. And then there are, of course, variants of interest. Those ones look like they could do harm to humans. And throughout the pandemic, we've had 5 variants of concern: alpha, beta, gamma, delta, and now Omicron. And up until the time we stopped counting and testing in early 2022, it had killed around 7 million people and infected about 880,000. Those numbers are significant undercount. And so the actual number of infections and the actual numbers of death are far, far higher. That is what's reported today on all of the dashboards that anyone can go look at. So it is a nasty virus. And initially it attacked both the upper respiratory tract and something called the type 2 pneumocytes in the lung. These are part of the alveoli in the lung. These are little air sacs that are surrounded by very, very small blood vessels. And under normal conditions, without a virus present, it's how we circulate our blood through the body and pick up oxygen in the lung and drop off CO2. So when you breathe in, oxygen attaches to your red blood cells. When you breathe out, you're breathing out the CO2. So the oxygenated blood runs around your body in your arteries, giving it the life-giving oxygen it needs, and then it picks up the CO2 to get rid of it, and then repeats the process over and over and over again. Excuse me.
I have a question. There is a feeling out in the world with who do not understand the nuts and bolts of COVID. This is over. Like we're on the backside, or it's not as serious. It's milder. I would really like you to try to address how that is so degrees opposite to the truth. Because I addressed it for me in the past, and it's kind of shocking. Could you address why it's so dangerous?
Yeah. It is so dangerous because it is so different from the other coronaviruses. So I think what we should probably discuss is, how does this virus compare in terms of
Please. Yeah.
how people get infected with SARS-CoV-2 versus all of the other coronaviruses, and why this particular virus caused the pandemic of the century, of all of our lifetimes, and it's still continuing 5 years later. It has not gone away. People are dying every day. Okay. People are regularly hospitalized. Yes, it is not at the same level as Alpha, Delta, or early Omicron, but it certainly hasn't left us by any stretch of the imagination. And so we have to keep vigilant and fighting this virus for as long as it takes. So how does this differ, okay, from other coronaviruses or other pulmonary viruses like influenza that gets into us? Well, SARS-CoV-2 changed the entire game of coronaviruses because it does most of its transmitting to other human beings asymptomatically. Even those that are going to go on to develop symptoms, the infection happens without any symptoms whatsoever. Okay. Now with SARS-1 and MERS, it was that those viruses were only infectious when they had developed symptoms. COVID-19 from the SARS-CoV-2 virus, COVID-19 is the disease. The difference when you transmit everything asymptomatically is that you have a huge number of people being infected who don't know that they're infected. And this perpetuates the cycle over and over again. It also has a unique feature now. Lots of viruses have asymptomatic individuals when they're infected. But SARS-CoV-2 is a little different. It has stayed consistently at around 40% of all the people infected will simply remain asymptomatic. But the catch here is that in SARS-CoV-2, those asymptomatic individuals, depending on the variant of concern, can pass on the infection to others. So with some variants of concern, that was at about 40%, and with other variants, it went up to as high as 65%. So you have this population, 40% of everyone infected, who can pass on this virus without even knowing they're infected. And those who are going to develop symptoms, okay, happen after this incubation period. And I usually use the split 80-20, even though virtually all infections happen pre-symptomatically or asymptomatically. When you do develop symptoms, we classify them as mild, moderate, severe, and critical. But the real thing, the take-home lesson from this is that virtually everyone is being infected by people who don't realize they're infected. Okay? And that infection can take many forms. It could be me and you sitting across a table. And I'm sure all of the listeners have heard, oh, it happens within 6 feet or 2 meters. Well, no one's actually measured that. Okay. It's just a rough estimate of what two people sitting across a table would be like. So you can transmit the virus by direct deposition of respiratory droplets. You know, you can cough, you can sneeze, you can talk loud, you can even sing. The more you project your voice, the more virus that you then pass on to others. So that's one mode of transmission. The larger of the modes of transmission is airborne transmission. So much smaller particles, when they get exhaled by someone who has been infected, will hang around in the air attached to dust particles. Okay? And these are small particles that are about 5 microns or less in size, and they can float in the air. All you have to do is walk through the room, breathe it in, and you get infected. All of the coronaviruses, and SARS-CoV-2 in particular, only enter the human body through the mouth, the nose, or the eyes. Okay? And the third type of transmission is called fomite transmission. And I think everybody will remember back in 2020 and early 2021, bringing their groceries home, wiping them all off with disinfectants, wiping the surfaces all day long, because that is a mode of transmission, but it is the lowest type and form of transmission. So if you think about how this moves between people, and you now understand that it all happens asymptomatically. You should be able to understand the idea that it transmits easily, but it does so stealthily, because no one knows they're infected when they transmit. And like I said, I use an 80-20 split for the asymptomatic and pre-symptomatic, because people who get severely or critically ill, the virus does not wane, 8 to 10 days after you become symptomatic. The virus just keeps replicating. And that's how all of the healthcare workers got infected in early 2020, especially in Lombardy, Italy. And we quickly learned that we needed to up our game of infection prevention and control, but specifically getting people the correct PPE, personal protective equipment, that they required in hospitals so that they could actually treat patients. So think about the difference between a virus that only transmits when you have symptoms, like SARS-1 and MERS, okay, and the 4 common cold coronaviruses. It is a completely different mechanism than what SARS-CoV-2 does. And it's why this pandemic is not yet over 5 years later, okay? Because people just keep infecting other people, not knowing they're infected themselves, okay? And essentially all of the transmission is asymptomatic, pre-symptomatic, but I break it up in those two 80-20 categories because those who are severely ill keep making virus. The rest of us, if we develop symptoms and don't end up in the hospital, by about 10 days out, they no longer have detectable virus by molecular testing methods like RT-PCR. Okay. So it causes the symptoms. It then leaves the body and you gradually get better. And that happens when we're talking about people with mild and moderate symptoms. Those with severe and critical symptoms are almost always hospitalized. Okay. So because of this mechanism of transmission from human to human, and using all 3 of the mechanisms of transmission, close contact with respiratory droplets, whenever we speak or, cough or sneeze, they're projected towards anyone around us. Airborne is much more dangerous because it's hanging in the air. You don't know it's there. And all you have to do is walk through that space. And for people who are trying to understand that, this links directly to what everyone was telling people about the public health and social measures, also called non-pharmaceutical interventions. Stay outside. Don't go into crowded indoor spaces. Okay. Don't go into any indoor space that has poor ventilation, because those airborne viruses will just keep sitting there and infecting more and more people as time goes on. And this is unusual, certainly a first for the coronavirus family. And as we've gone through from the wild type virus, the original Wuhan strain, through the variants of concern, I think we all remember how traumatic that was to see how many people were dying so quickly. So you can think about the news from 2020 in Lombardy, Italy, but probably everybody on the North American side was much more familiar with the fact that the hospitals in New York City all had to park refrigerator tractor trailers in their backyard because there were so many. The morgue was full, and we were filling up 48-foot trailers with more and more bodies, and then taking them for burial. So it was a huge hit to the human population in 2020 and 2021, but it does still continue to this day.
Because this is a follow on to what you just said about New York. To clear up a bit of a misnomer out in the public, to a brand new pandemic that is still SARS-CoV. Like, can we have a brand new, serious, go right back to body bags and go right back to stacking up bodies like cordwood? Can we go back there? How do we get back there?
Yeah, so it's just like every other variant of concern. So we have 5 of them. Could there be a 6th? And could that 6th be even more dangerous than the previous ones? Absolutely. Okay. We got lucky with Omicron. It was very deadly at the beginning, but it went through and generated more than 2,000 subvariants of itself, and spent a lot of...
Just for a second, just a sec, Roy, because you just said something that, see, people, there's 4 variants, and that's all there is. You just said 2,000 subvariants. That's a significant amount of scientific problem.
Yes, and with each of those subvariants, the trend we've been following is because the virus SARS-CoV-2 attaches to the ACE2 receptor. Over time, as we've gone through these different variants of concern, we've been noticing a fairly disturbing trend. And that is that most of the mutations and changes in the virus, and that's what viruses do, they mutate regularly. They don't have a way to replicate themselves, so they use our machinery. And I can explain that in a moment. But with the variants of concern and what we've seen in well over 2,000 subvariants now, is that the virus accumulates the majority of its mutations within its spike protein, usually in the receptor binding motif or the receptor binding domain. That sounds fancy, but all it really means is that the virus has spikes that stick out on the surface, and it attaches to the ACE2 receptor on our cells that also extends onto the surface. And then there are molecules that help it get into our cell. And once it's into our cell, then it can make multiple copies of itself, co-opting our own machinery that normally makes proteins dictated by our DNA and our body requirements. So it takes over our system. But what has also been happening over time, and if you look, especially if you look at the 5 or 6 most recent subvariants, and especially what was dominant here in North America, KP.3.1.1, and then what emerged in Europe a little later, which was a recombinant called XEC. Those 2 strains alone, when you look at the dynamics, there have been so many changes in and mutations within that spike protein that it now binds to the ACE2 receptor much more tightly and then gets into our cells more quickly. So you should think about the binding to that receptor, how well that fit works, okay, equates to infectiousness, okay? Because the stronger it attaches and then gets into you quicker, the more you're going to start making multiple copies of the virus in every single infected cell. And that can be thousands and thousands of cells in just one person. And then they get released from the cell back into the respiratory tract so you can breathe it back out and infect someone else. Okay. And that binding strength, we call it affinity, uh, became a huge part of what we see around us today and why there's actually more virus floating around today than there was 2 or 3 years ago. And the second part of that is, well,
Wow.
why, you know, the second part of that is, what else did it do? Well, it started, again, it comes from mutations. The vast majority of them don't give any advantage to the virus, but every once in a while, a combination does. So not only was it binding to the ACE2 receptor stronger than any other previous variant, it was also becoming more and more immune evasive, which means that it could get around the protections of the immune system to get rid of the virus. And that has been the current trend. So coming back to your question, could we have a sixth one tomorrow? Absolutely. There's nothing that says that the current trajectory we're on is one we're going to stay on. Okay. So with viruses, anything is possible. And we could get a much more virulent version at any time. And that should be a concern to everyone. But where this binding strength and faster entry into the cell, therefore infecting more cells and replicating itself more often, as well as becoming more and more immune evasive, people should understand that that's what's driving the fact that not only can they get infected once, they can keep getting infected again and again and again. Because the protection that you get from a natural infection, okay, wanes quickly over time. And that waning has been increasing over time. So now a natural infection may, give you protection from disease itself for maybe up to 6 months in a good case, but it's often closer to 3 months. And you may have some protection against hospitalization, serious disease, and death, but even that wanes as well. And the opposite side of the equation, where we now have vaccines that mimic that same process, they also wane just like natural infection. So we are never going to reach the point where we have enough people infected that we would protect each other, or enough people vaccinated that you get to something called herd immunity, which probably can never exist in SARS-CoV-2 because it just keeps mutating too quickly. And it infects large numbers of people, which just amplifies those new changes. And those new changes just make their way around the world. Okay. So I've been vaccinated 4 times. How is it possible that I can still get infected? I've had the virus twice before. How is it possible that I can get infected again? Well, it's because the virus is changing its characteristics. And with the vaccines, we're trying to play catch up. Okay. We're chasing subvariants. Okay. So the latest vaccines out for 2024, 2025 are going after Omicron subvariants. There are only 3 authorized in North America. 2 of them are mRNA vaccines that go after KP.2. There is a Novavax protein subunit vaccine that goes after their parent strain, JN.1. Well, if we continue this game down the road, it's kind of a lose-lose, because even though we do get some population immunity from natural infection and vaccination together, it doesn't seem to prevent reinfection or the need to be vaccinated over and over again. And it's the SARS-CoV-2 virus today has settled into two major spikes of activity, one in the middle of the summer that just recently ended and lasted 5 months, and another one through the winter months. So we're only getting 2 or 3 months off. And the only way to fight that, unless we improve the vaccines that we currently use and stop chasing subvariants with vaccines, because they come and go before the vaccine is ready to put into people's arms.
And hang tough for a minute. One of the reasons why I wanted to introduce the world to Doc Roy, as I call him, is you're actually touching our next show. So much confusion around what COVID is and what vaccines are. And the confusion is so that's a show unto itself. And we're going to do that one next. But the last topic I wanted to talk about is that, and I just bear with me, Roy, because I'm going to use Larry language. What a lot of people don't understand is how many people a year before there was even vaccines, they don't even get it. They can't put those two things together. So they want to put all this blame on the vaccines, and they don't understand the beast that we call COVID-19. It's a body and system destroyer. So my question is this, that talking about multiple infections, I can say from the research that I constantly post that the number one cause of my thing, which is long COVID, is the COVID infection. That sounds obvious, and of course it is, Larry, but I don't think people have tied together how important it is that these random things are happening and you're getting multiple infections and you don't know which infection is going to take you down. One, you may never go down, but the people that are getting long COVID, the virus isn't clearing. And the confusion around vaccines and COVID and all, people don't understand that this constant mutation of a virus is reinfecting the world over and over and over. And we're chasing our tail. And that's why it's dangerous. So with your closing comments about COVID, can you address kind of what Larry just kind of stumbled over? I can give it some better recap.
Yeah, not a problem. But so we all need to understand that with this virus, it's not going anywhere. Okay. It's going to be with us for a long time. And I am one of the believers that the current number of deaths that is more than 1 million per year, even though we're at a fairly low level, we talk on a global level. Okay. The actual curve of, how far the virus comes down, it has never gone down to anywhere near zero. So even between these spikes of infections, there's enough virus around to continue to infect people. Okay. And we have a whole suite of tools at our disposal, not just antivirals and vaccines. We have, call them behavioral modifications, if you want to protect yourself, okay, and protect others. So an important part of that story is that there are an enormous number of people in the world who have an inability to fight SARS-CoV-2, okay? And we call them vulnerable. And I think one of the shameful things of the pandemic is that we did not do nearly enough to protect our elderly, especially in elder care homes. That that was a huge lesson that we've had to learn. So elderly are, one of the top vulnerable groups. But what most people don't know is that anyone who is immune compromised or has an autoimmune disease or even has another disease that, yeah, yeah, that the treatment, okay, may knock down your immunity. And the best example of that is, chemotherapy and radiation for cancer. Okay. Well, if you take those treatments, it also knocks down your immune system so you can't fight it off. So you'll always see those people wearing respirator masks. You will see them avoiding people whenever they can. And, think back to the days in 2020 and early 2021 where we were using the very specific tools that can actually control a virus like this. And then we decided we were just going to stop and get on with life. But when we did that, we allowed the virus to take over again. And this virus just keeps making new forms of itself in terms of the subvariants that are invariably more infectious and more immune evasive. And when you have those two things together, there's no easy way to stop this. And it's the reason why having a natural infection doesn't give you long-lasting immunity. It's the reason why the vaccine doesn't do it either. People have a misconception that all viruses are like measles. You give somebody 3 doses of the MMR vaccine and they never get the disease again for the rest of their life. That is the exception, not the rule in viruses. Okay. Very few viruses, especially respiratory viruses, can ever get into that pattern. So think about the largest respiratory virus we deal with on a daily basis. Influenza. Every season we have influenza. But what else do we have every year? A brand new vaccine that's formulated for the likely strains of influenza to infect us in the winter in the Northern Hemisphere. Okay. So also being a respiratory virus, this is kind of how the game works. Because of these high mutation rates, you are not going to get ahead of the game unless you are using multiple protective layers. So if we had a good vaccine today, so pick one of the new ones, if we could add that to a nasal mucosal vaccine that's delivered by a nebulizer or a spray, and if everyone was wearing an N95, KN95, or FFP2 respirator mask, we would knock this virus down tomorrow. But because we have all of these conspiracy theories out there and all of the anti-vaxxers and anti-maskers and people who don't want to, stay outside rather than inside, don't want to avoid crowds, just want to let her rip, that just fuels the SARS-CoV-2 virus to keep moving through the population, and it will just continue to infect and reinfect and reinfect and reinfect. And every new vaccine we come up with, if we're chasing the subvariants with those vaccines, they will wane just as natural infection wanes. Okay? The protection goes away. So this is the exact opposite from a vaccine for measles. Whereas once everybody's vaccinated, even if you had 5% of the people who couldn't take it for medical reasons, that 95% of people who are vaccinated for measles, okay, that is true herd immunity. The herd who are no longer susceptible to measles protect the small population that, for usually medical reasons, cannot get the vaccine. The virus has no place to go, and
Yeah.
it's not like you have 5% in every single group. This is spread on a population level. So where the virus could go to, it may be one or none in any given small little group. Okay. And that's where the protection comes from. But that's also where people got the idea that vaccines after 2 shots will give you lifelong immunity to viruses. Well, for measles, yes, but it doesn't work for respiratory viruses that have errors when they copy themselves, okay, and also have a natural rate of mutation that's very high. So influenza actually has a higher mutation rate than SARS-CoV-2 does, but if you SARS-CoV-2 is everywhere on the planet, and it's not going not going away anytime soon. Okay, people, the public health emergency of international concern is certainly over. We are not dealing with the numbers of hospitalizations and deaths we were before, but people need to realize that we also haven't come down to zero either. Okay, so in epidemiological terms, when we talk about viruses and where we stand, there's a real simple concept called the basic reproduction number. It simply means if I get sick, how many people am I likely to infect as one person? Okay. If that number is above 1, the infection just continues to spread. If it's equal to 1, it's a steady state. If it's below 1, it's declining down and may potentially disappear. Well, we haven't got close to 1 in 5 years. So we sit way above.
Yeah.
I think this week's current number is about 3.13. So the average person is infecting 3.13 others. And this just continues to go on. And so what upset people in 2020 and 21 having to hide away in the house and to wear masks and not do any of the other things that they love, if they hadn't done that, we wouldn't have healthcare systems anymore. They would be completely flooded by COVID-19 patients, and those healthcare systems would collapse. And they certainly wouldn't be treating people with strokes, heart attacks, lung disease, cancer, and all of the other diseases out there. Okay. And the other nasty part about the SARS-CoV-2 virus is that it has what are called post-acute sequelae of COVID-19. Let's be real simple. Long COVID, long haulers, same thing. The science term and the colloquial term. Okay. So even today, about 10% of people who are infected will go on to have symptoms of long COVID. That's a huge proportion of the population. Okay. And that results to a certain degree from almost all viral infections, and especially pulmonary virus infections. But it doesn't happen at the rate of SARS-CoV-2. Okay. 10% of the population getting long COVID, and likely 10% of them never getting better, is a huge cost, a huge drain on our healthcare system. And if we don't do something to stop all of these new infections, if we don't stop SARS-CoV-2, if we continue playing the game as we're playing it today, then we're just going to keep generating people with long COVID. So we've kind of swapped the major spikes with huge numbers of deaths, for people getting long COVID and having serious illness for the rest of their life. I mean, a certain proportion of them never able to rejoin the productive population again. So, in my opinion, that is likely going to cost more than all of the COVID measures, the payments made to people to survive, to stay in their house, to protect the healthcare system from collapse. And these are serious issues we should be discussing. But I don't know, look around, Larry, other than in science journals and among scientists, it looks to me like the population of planet Earth think that this has gone away. Pandemic's done, no worries. And
Fatigue.
that is not the case at all.
Yeah.
Of course it's fatigue. I mean, we have never experienced a pandemic that has gone on for 5 years.
And again, I don't think people hate that. So in other words, they don't, if they're not feeling themselves, sense of the dynamic of it globally, and they don't get a sense of what's going on behind the scenes and the fear that politicians have right now, that the healthcare system has. I mean, here we have, like yourself, one of the top guys in the world, and you understand the fear dynamic. You don't play it. You don't underplay it. You're just telling it the way it is, and people will try to spin it so that it works in their head. They don't want to face the truth, and I think it's because of fear.
Yes, I agree. And fatigue as well, as you mentioned. Those two together, and we also have to lay, some of the blame at the feet of the people we expect to be helping us in all of this. So our governments, when we just utterly stopped all public health and social measures, some people like the term non-pharmaceutical interventions, social distancing, hand washing, masks, isolation, testing, contact tracing, isolation, quarantine. If we were still following that pattern, we wouldn't need to be locked down at home at all, because we have the tools today to go fight the virus where the virus pops up. Okay?
Yeah.
But we still need to be protecting ourselves. But the really big deal here is we have an absolute obligation to protect those who can't protect themselves. The elderly, the immune compromised, sometimes by treatment for disease, they become immune compromised, and anybody that has a multitude of comorbidities. They're all very vulnerable. And to end this, the most vulnerable are people who are unvaccinated. And they probably won't like hearing this, but if you compare case fatality rates or infection fatality rates between vaccinated versus unvaccinated, for every death in a vaccinated person, on average globally, there are 14 deaths in those who are unvaccinated. And that message is just not getting out there.
Well, let's leave it there, Roy, because you and I are going to talk again in probably, I'm thinking 1 or 2 or 3 weeks, and we're going to actually pick up from here, and we're going to start at ground zero on what is a vaccine. And great confusion out there. And I'm my background says, we need to get the conversation back started that COVID-19 is a beast. And quit the nonsense about vaccine this, vaccine that, vaccine this, vaccine that. Yes, there's issues. They're being addressed. They're being studied. They're being researched. But we wouldn't have any vaccine conversation if there was no COVID. And that's just kind of keeping our eye on the ball. So thank you, Roy. Any closing comments, or are we good for the next session?
I think we're great for the next section. And you can probably expect me to come back to a few of the issues of COVID itself that I didn't get a chance to touch on today, and because they relate directly to the vaccines as well. So I think we can paint the picture for people, what's going on, what they can do for themselves and their families, what they can do to protect their neighbors, and what we can all do to protect our elderly, who we've done a really poor job of protecting throughout this pandemic. So anybody who thinks that the virus is gone is badly mistaken. It hasn't gone anywhere. And the last summer wave was the biggest summer wave in 5 years. Okay, so the
that's
amount
the thing.
of
Yeah.
no, and yes, well, they don't know that there's more virus out there today than there was 4 years ago.
Yeah. Again, people are lost in the fact that they just don't know. They have confirmation bias by watching their favorite show or their favorite speaker, and that's their point of knowledge, and it's just dangerous thinking. Thank you, Roy. Thank you very much, or as I call you, Doc Roy. Let's do this again, okay?
Yeah, happy to help, Larry. This was fun.